morning. Thank you for this invitation. I really appreciate the offer to come and talk to you about our program. 1990, Steve Britton, he's one of my collaborators and long-term mentor for a long time. We formulated what we call the so-called energy hypothesis. And the energy hypothesis was simply the variation capacity for energy transfer is the central mechanistic determinant of the divide between health and disease. So Britton is a theoretical biologist, and so he and I looked a lot at papers like some of the papers were Hans Krebs and Jack Baldwin's Evolution of Metabolic Cycles, Kinesiological Theory by Peter Mitchell, and Ilya Prigoghine's papers. So Steve Britton had these mantras such as, you don't get something for nothing, motion is function, or you get order from disorder. So that's our energy hypothesis. We actually have some ideas of disorder. But really the motivation for this project was the emergence of clinical literature beginning about 50 years ago that supports this really strong statistical linkage between high aerobic capacity and health. What I mean by this is maximal aerobic capacity, or VO2 max, appears in the literature as a really powerful predictor of all-cause morbidity and mortality. So this is a graph of Jonathan Meyer's paper. It's probably one of the most highly cited papers in exercise physiology on this topic. It looks at survivability, or years of survival, and based on patients that were, whether cardiovascular patients or non-cardiovascular patients that were sent to the VA hospital to get exercise testing. And the survivability shows across 13 years from normal adults with no signs of cardiovascular disease based on maximal exercise capacity test. Essentially what this graph is showing is for those that have high metabolic or aerobic capacity, over a 13-year period, 85% of them were survivable if they had high aerobic capacity. This is measured in MET levels. Or if they had lower MET levels from the very beginning, only 45%. So it essentially says that one MET increase is equal to 12% survival increase. So the other thing that this paper showed was that aerobic capacity or maximal exercise capacity is a stronger predictor than some of our common indicators such as hypertension, body mass index, dyslipidemia, history of smoking, some of these things that physicians already look at, whereas exercise capacity seems to be a stronger predictor. So we reasoned that maximal treadmill running capacity can be used as a proxy for energy transfer. I am an exercise physiologist, but we're really using exercise, maximal exercise capacity, as a proxy for energy transfer. So we reasoned that divergent two-way artificial selection based on exercise capacity in rats would yield contrasting models that also divide for health and disease. In other words, if you took the trait of aerobic exercise capacity and you selectively bred rats that were innate, were born low, and rats that have high in aerobic capacity, the question was not using exercise as an intervention, but use exercise as a trait to selectively breed and then see if those animals would divide for health and disease. So in other words, low capacity would equal disease, and high capacity would equal health. So from our approach, we had to devise essentially a simple test of exercise stress for a rat. It's a speed ramp treadmill, just like they do in the clinics. We assessed rats for their innate aerobic capacity. We're not training them. We're not interested in the training effect because that's an adaptive effect. We're interested in the intrinsic or the congenital or the innate aerobic capacity. And we also use selective breeding, and we base it on the best or the worst treadmill distance out of 3. And we also use a genetically heterogeneous founder rat. So here is our response to selection. Here's our founder population in yellow. And that also is about where you would buy if you were to purchase a rat commercially available. They were exhaust at a treadmill exercise. We had about 360 meters per minute. If you selectively breed for the trait, the purple rat shows how we can selectively breed for high exercise capacity or HCRs or low exercise capacity put it in perspective, it's a 15-minute runner versus a 75-minute runner inborn. 200 meters or 2,000 meters or 0.25, a quarter mile versus a mile and a quarter, or and also has a heritability effect. So we know that we're genetically transmitting that. So these are very large colonies. We couldn't study them all ourselves. So our whole plan was, from the very beginning, was to find content experts that can test our energy transfer hypothesis on things that they do. So we're essentially a research resource that sent these animals around to other places. This is what the complex disease risk that emerged with selection. All of them started with something as simple as, or as powerful as metabolic syndrome, which was published in Science in 2005. And so here's like 8 other ideas that came across. Physical inactivity was highly correlated with LCRs, rats, higher risk for the HCRs, fatty liver disease, or actually putting them on a high-fat diet. LCRs would be higher at risk, disrupted sleep, metabolic dysfunction in the muscle, memory and impaired learning, stroke-induced brain injury, Alzheimer's disease, and even cancer if you're giving them a breast cancer-inducing agent. The other thing was which ones live longer, and obviously the high-capacity rats live longer, and compared to low-capacity rats, about 6 or 8 months. And the median age of death was 24 months for the lows and other ones for highs. And they essentially died of the same things, just age-related diseases. So I wouldn't be standing here talking about it if I didn't have the idea that mitochondria was probably the strongest predictor of our metabolic dysfunction in our low-capacity rats versus our high. So there's almost all those papers that were from all those other countries. Every time it showed ideas about exercise capacity or mitochondrial oxphos, electron transport. So here's a study that was done at the NIA that looks at cross-sectional data, looking at mitochondria across time, showing that respiratory capacity in cardiomyocytes associated with longevity. HCR was more efficient, we're burning more fats. The autophagy and mitophagy were also more preserved in the highs compared to lows, and they seem to be more resistant to oxidative stress. So this was a very extensive, thorough study that was done. In 2020, our collaborator, Bill Malik from Wayne State, he's a physical therapy, interested in therapies. He heard the seminar from James McCullough, and then was very excited and thought immediately of our rat models as a way to approach people that cannot exercise for therapy. And he went to McCullough's lab, learned the technique, brought it down to Toledo, and we performed 2 experiments. And I'm just excited about this because it's therapeutically tested energy transfer hypothesis. The first experiment was simple. It was just a muscle to muscle by injecting the old rats into the high rats, and you get differences in improved running capacity. These are very aged rats, so the mitochondrial differences were not much. And the low capacity rats, or the high, there's an ATP and tox. The second thing was evaluating them for systemic tail vein, low capacity versus high capacity, longevity, and then also looking at those differences. Essentially, I'm very new to mitochondrial, but I was excited to know that there's another way that we can actually look at our energy transfer by swapping the low capacity rats and the high capacity rats, or vice versa. We also have done some longevity studies to look at these differences. Thanks, I can stop. This stuff is so cool, just developing a model. It's too exciting to actually talk about. So.